so forth around how our healthcare system is in some ways, it's incorrectly named as really a sick care system. It's really, you get sick and you go and get treated, right? And that true healthcare would be almost like do a lot of preventative stuff. And a lot of the things you read about how to improve your health generally kind of falls into a couple of things, right? It falls into like eat better, exercise, get more sleep. Somewhere within that framework, right? Is there a way, or have you seen other countries almost try to? I don't even know what's the best way to ask this, like to incentivize those things in their quote unquote healthcare system, or is that just like everyone's healthcare system? It's like that's too difficult to manage. That it's really managing the sickness part that's easier, so everyone does it that way. Or is there certain countries that have done like this, almost like look at that from the preventative side?
Oh, absolutely. And, the problem is we know that things like good housing and education, green spaces, I mean, we know that these kinds of things uh, minimize the kinds of illnesses and diseases we have out there. The more that people eat better and exercise, if they live in, reasonably good accommodation, they will have better health. We know that, and we know that this will keep them out of hospitals. What we don't know is how to sell this to the public such that they would accept this. So, essentially, these are called the non-medical determinants of health, or the social determinants of health. And we know that there's a link, but the problem is, or the question is, how much will we as a society agree to pay for these things, right? And the problem is that, the people who are taxed the most already enjoy these things, so they um, are not as inclined to increase taxes to pay for the things that we know generally will work. And that's the kind of political dynamic you find in every country. Some countries, the Northern European ones, so for example, the Netherlands has a really good healthcare system and is quite thoughtful about these other non-medical determinants of health, but they also are willing to pay for them. And Canadians are a lot more like Americans, and they insofar as they don't want the state to get involved in these kinds of things. So again, we know that these things work, and that if we had really good housing, then the health of the population would probably be better. But how we get to that point, again, is a hugely political issue, and we just don't know how to get there. And also remember, it's also that there's so many, where there are winners, there's also losers. So anything as seemingly anodyne as limiting the advertising of junk food to children. We tried to do that federally, and it always failed. Why? Because you had interest pushing back. So, for example, you have companies that shall go nameless that support sports for kids, like little like soccer leagues. And if when the advertising was suggested, some of these companies went, well, if you're not going to allow us to sponsor uh, junior soccer, then if you're not going to allow us to advertise, and advertising has their emblem on the soccer jerseys, if you're not going to allow us to do that, then I guess we can't sponsor soccer. Well, of course, all the bourgeois parents who'd love to have their kids in these leagues are going, well, we can't afford hundreds of dollars to put our kids in these soccer leagues. So we want these companies supporting soccer leagues. So we don't support your. So there are all these are called the commercial determinants of health. So there are all these commercial interests which push back in such a way that the public recognizes that, again, it may be advantageous immediately for them to tolerate their presence even though in the long run, we know that there's a link there. So these are hugely politically intractable problems, and some countries have, you know, better ways of dealing with them. Some populations are much more receptive to them, but in Canada, it's a bit of a hard slog, actually.